afternoon, everyone. I'd like to call this meeting to order and ask the clerk to conduct a roll call.
Thank you, Chair. Councillor Bateman.
Present.
Councillor Crater. Councillor Diodati. Councillor Easton.
Present.
Councillor Foster.
Present.
Acting Regional Chair Ganan.
Present.
Councillor Encina.
Present.
Councillor Yip.
Present.
Councillor Jordan. Councillor Kaiser.
Present.
Councillor Olson.
Present.
Councillor Rigby.
Present.
Councillor Seaborn. I see her there. Councillor
Sorry, present.
Ready, willing, and able?
Councillor Sorrento.
Happy to be here, Clerk.
Councillor Whalen.
Present.
And Councillor Witteveen.
Present. Thank you.
Councillor Crater.
Councilor Crater, present.
Thank you.
All right, thank you so much. Now I'll call on Councillor Kyokyo to read the land acknowledgement statement.
Niagara region is situated on treaty land. This land is steeped in the rich history of the First Nations, such as the Haudenosaunee, the Haudenosaunee, and the Anishinaabe, including the Mississaugas of the Credit First Nation. There are many First Nations, Métis, and Inuit from across Turtle Island that live and work in Niagara today. The regional municipality of Niagara stands with all Indigenous people, past and present, in promoting the wise stewardship of the lands on which we live.
Thank you, Councillor. Now I'll ask if there's any disclosures of pecuniary interest. Seeing none, I'll move on to 4. I'll call on Dr. Kazmati, Medical Officer of Health, to introduce the Public Health and Emergency Services highlight video.
Thank you, Chair, through you and to Council. Appreciate the opportunity to present here today. As you may know or may not know, last week was Canadian Public Health Week. And so in order to celebrate, as well as really show the work that the region and public health does, and most importantly, that our staff do and the service we provide to our community, our team put together a short video that recaps some of the highlights from 2025 in a year in review. I don't actually know how to play the video, though, so I'm hoping that IT, okay, wonderful. Leave it to the experts. Hi, everyone. I'm Dr. Azim Kazmati, Medical Officer of Health and Commissioner of Public Health and Emergency Services here in Niagara Region. In 2025, our teams continued to deliver high-quality programs and services across Niagara, supporting more than 500,000 residents, as well as many visitors to the region. Much of this work happens behind the scenes, yet it plays a vital role in keeping our community safe, healthy, and thriving. Our services support people at every stage of life with a strong focus on health equity and reaching out to those who need it the most. We focused on prevention, working towards making the healthy choice the easy choice. We kept a close eye on health issues, always thinking about emerging trends and population health. We provided data to inform health decisions across the region. We provided prenatal education, infant feeding support, parenting classes, and home visiting programs to help families build a strong and healthy foundation. Our staff worked directly with schools to promote student well-being and healthy development. Dental screening and preventive care helped keep children and seniors smiling. Our team collaborated closely with community partners to bring public health services to vulnerable residents and meet them where they're at. Staff focused on ensuring students were caught up with immunizations. When flu season and outbreaks like measles emerge, our rapid and coordinated responses helped contain them quickly and safely. We offered mental health services for clients living with serious and persistent mental illness across Niagara. From inspecting restaurants, beaches, and long-term care homes to preventing rabies and other illnesses, our team helped keep people and businesses safe and confident through health inspections, investigations, and support. Our paramedics and emergency medical staff responded with skill, compassion, and professionalism to thousands of patients. Through the Mobile Integrated Health Program, in-home care helped residents avoid unnecessary hospital visits. And through it all, behind every service, every visit, every inspection, and every call, our teams were there for Niagara. Together, we're building a healthy, strong community, one that's supported, protected, and prepared for whatever comes our way. Chair, through you, thank you to everybody for watching this. And most of all, I'd like to provide through you, Chair, to our staff, a thank you. Thank you for providing preventive, cost-saving care to Niagara's residents to keep us healthy and thriving, as we said there. Again, if anyone has any questions on the stats or services, please feel free to reach out directly. I'd encourage everybody to follow us on Instagram and through our social media on LinkedIn and elsewhere as we continue to highlight our public health work throughout the month of April. And again, if you could continue to share this message along, we would certainly appreciate it. Thank you, Chair.
Thank you, Dr. Kazmati. I'll ask if there's any questions of Dr. Kazmati in the video that we have just watched. Seeing, oh, all right. Thank you. Councillor Goodwin, please go ahead.
I couldn't let the doctor get away without at least one question, so thank you for that. And so I guess my question to you, through the chair to the doctor, is so have we seen any trends, any changes in health, general population health that we may want to maybe direct focus on, or areas of concern?
So through you, Chair, I think every couple of years we do a population health assessment. And the last one really showed there's a number of factors that are always there for our consideration. Last year, we saw a pretty significant measles outbreak across the province. And so the ongoing need to continue our preventive immunization programs is there. We see a number of infectious diseases like tuberculosis, syphilis, and so we need to continue to provide care there, and that ongoing preventive work. Chronic diseases like heart disease, lung disease, cancer, those continue, and we need to continue to work with our system partners to address those. Mental health, I think drug use, alcohol use, these all have long-term effects on the population. And so these are the types of things we're monitoring. And certainly when the next population health assessment is completed, we'll come back to council presenting that data and our action plan to respond.
Okay, thank you for that. Nothing further, Madam Chair.
Thank you so much, Councillor. Next, I have Councillor Seaborn.
My laptop is not cooperating today, honestly. Thank you very much for the presentation. The one thing that did surprise me that you do is you take care of some preventative rabies. I noticed a dog there. I presume you do dogs and cats. Now, is that done in conjunction with our SPCA? First question. And the second part of that is, I know that in rural areas, there's a drop-off. I think it's done by a plane that flies over, and it drops off packages of rabies medication for wildlife. Does public health have something to do with that, or is that more of a wildlife program? Thank you.
So our work with, through you, Chair, last year we provided a clinic for folks who wouldn't be able to afford the vet fees and the vaccination fee to bring their animals in. And that's the type of work we do that's preventive, and we really try to focus on folks who need it the most. And so, if I don't have any pets, but if I did, I could probably afford to get it, vaccinated. And so I'm not the target audience, but it's really people who don't have any other means. And we know the importance that animals provide to people in terms of companionship and so much more. And we don't want them to then have to go through all of the impacts of not having an immunized pet. So we provide, and I say we, I get a lot of the credit, but it's really our team. It's really our staff who put in all the work to do this, to set it up. And I think it was held in St. Catharines last year. And so, many of you may have seen the long lineups we hadn't, and we were able to provide, and we were able to work with local veterinarians. I don't know the exact organization that we were able to work with. In terms of the drops and the wildlife related, that is not our core work, but we do continue to monitor and work with other partners in order to see which animals are affected, what the levels are, if any animals come back positive. And then we're able to share that information and create action plans should there be a risk. Our main area to deal with is human rabies, and so the other preventive efforts are to reduce the human rabies while the province and other organizations deal with animals.
It's all great news. Thank you so much for telling us.
Thank you, Counselor. Seeing there's no other questions, I'd like to thank you for your presentation. And Dr. Kazmar, I'd also like to thank your team for all that you do and for our communities trying to keep us safe and healthy. So thank you so much to everyone.
Thank you, Chair.
Okay, I'll move on to point 5, delegations. There was one delegation on the agenda today, and I'll call on Sil Roche, Niagara Advocacy Coalition, for the delegation respecting a motion. And also just to remind Ms. Roche that there is a 10-minute limit. Welcome.
Thank you very much, Madam Chair. So my name is Sil Roche, but I'd like to begin by introducing the organizations representing Niagara's Advocacy Coalition: Queenston Neighbors Association, St. George's Anglican and St. George's Breakfast Program, the Cathedral of St. Catherine's and Out of the Coal Program, Trillium United, Silver Spire United, and St. Thomas Church on Ontario Street. Our purpose is to provide a voice for vulnerable citizens. Our long-term goal is to continue to advocate to upper-tier government for supportive and deeply affordable housing. Excuse me. As the representative on our coalition for Queenston Neighbors Association, I take this opportunity to acknowledge and to thank regional staff for addressing some of our concerns, including the lack of a St. Catherine's emergency overnight shelter. Region responded by opening over 40 beds at St. George's Church, enhancing NASO hours and staffing during cold alerts, and developing an inventory of cold weather supplies available to NASO workers for our unhoused neighbors. Adjusting 211 after-hours access process made available until 11 p.m. during a cold weather alert. While we have continued to advocate for an increase in the cold alert threshold excuse me, of minus 15 Celsius, minus 20 Celsius with the wind chill factor, today we offer support for the motion put forward by Councillor Cisco, the Mayor of St. Catharines, for a seasonal shelter. The advantage of being part of the Niagara Advocacy Coalition is the experience and knowledge that our members bring. People like Susan Vendetti, who was part of the original emergency overnight shelters that the church is hosting the Out of the Cold program. Sue Kingsley from St. George's Church, where the emergency overnight shelter is currently housed. She bears witness to those using their facility and of those who wait outside, unhoused neighbors, hoping that the church's doors will open for shelter. I have often witnessed people on the front step of Queenston Street's Westminster Church, where the shelter was housed there, sometimes still on the front steps, having waited and spent the night outside because it was not a cold alert threshold that day. As the executive director of Westview Center for Women eloquently put it, people don't know that it's not minus 15 outside. They don't know about the Niagara Regional Cold Alert threshold. They just know that they're cold, which again supports Councillor Cisco's motion in identifying seasonal shelter options to ensure continuity of care. On January 10th of this year, Regional Homelessness Services declared an extreme cold alert and adjusted the cold alert threshold to minus 10 Celsius for the remainder of the season. But the winter system triggering the cold alert had already begun with rain on the evening of December 26. This further supports Councillor Cisco's motion that reliance on temporary, short-notice emergency responses during cold alerts are not a substitute for an adequately resourced seasonal shelter program. Because the services that our unhoused people rely on are located in city cores, the majority of them live in St. Catharines, Niagara Falls, and Welland's city cores, not unlike many cities in Ontario. However, they are all citizens of Niagara, and it is the responsibility of our homelessness services of regional government to provide for their needs. Recognizing the role of our regional counselors in funding this service, we provide you with the following evidence-based data for your consideration for the 2026-27 winter plan. A study conducted by the MAP Center for Urban Health Solutions on Toronto's homeless population found that 72% of hypothermia cases in people experiencing homelessness occur when temperatures are warmer than -15 Celsius. Rain, snow, and damp amplify the effect of cold temperatures. People who are homeless in Toronto account for 20% of hypothermic deaths. It is worth noting that Toronto, with similar winter weather conditions as Niagara, their temperature threshold, cold alert temperature threshold, is -5 Celsius, -10 with the wind chill factor. And although I retired as a medical office administrator, I wasn't quite sure if hypothermia and frostbite were the same. So I reached out to my old boss to seek medical clarification, which I also share with you. Hypothermia can lead to frostbite. Loss of digits and limbs can occur if exposure to the cold is prolonged, and death after organs shut down. Our member, Gail Wiley of Silver Spire, who prepared the research document made available to you today with our delegation, contacted Dr. Wang, lead researcher of the MAP study, to inquire about evidence-based data on frostbite. The study compared cold-related injuries over the course of 4 winters for unhoused people versus housed individuals who required emergency department visits. They found a ratio of 268.9 to 483.9 in 100,000 cold-related injuries for unhoused patients, versus only 15.8 to 30 in 100,000 emergency department visits by housed patients. The research document provided to you also informs us that the freezing point of skin is slightly below the freezing point of water. The skin surface freezes at -3.7 Celsius to -4.8, with wet skin cooling even faster. On one of the days that I was volunteering at Start Me Up Niagara, I stood at the window of the resource center with one of our participants as we both watched the first snowfall that winter. This person was unhoused and lived with schizophrenia, and he said to me that although he liked winter, he didn't like getting wet. I never fully appreciated what he was trying to tell me that day until I read the findings of this study. Listening to the weather forecast on CHCH News during the extreme cold weather event this past winter, which will be more frequent due to climate change, I was always shocked to hear that frostbite can occur in minutes, so make sure you bundle up and don't stay outdoors too long. Two things that Niagara's unhoused citizens often cannot do. Again, further supporting the need of a seasonal shelter in St. Catharines and other large city center cores. In exploring the cost and operational requirements associated with a seasonal shelter program, a proactive measure, counselors may also want to compare the additional costs for a reactive measure of operating emergency shelters at -10 Celsius this past winter. We have learned that operating the emergency overnight shelters costs $11,575 per day. But how many actual days resulted from the adjusted cold weather alert change at -10 Celsius? How many people stayed in the emergency overnight shelters on those days? Our requests today to Niagara Regional are to consider the findings of the MAP study when setting the 2026 winter plan. In comparison to Toronto, with similar winter weather condition and a cold alert threshold of -5 °C, establish if a cold alert response of -15 °C is evidence-based and meeting the needs of Niagara's unhoused. Under the Homelessness Prevention Plan, the province's increasing homelessness raises concern already identified by homeless services staff. The demand for shelter in Niagara remains high due to average rental costs, impacting clients' length of stay in shelter as they struggle to find affordable rental units. We too acknowledge this reality, but an emphasis on housing over a person's well-being must also consider the vulnerability of the unhoused while they await the planned affordable housing. Homelessness services staff are absolutely right to say that investments in housing, and in particular supportive housing, is a key component to an effectively functioning homeless and shelter system. Both are necessary and cannot come at the expense of the other. We, the members of the Niagara Advocacy Coalition, thank you for your time and for the opportunity to present to you today.
Thank you, Ms. Roach. I tell you, you were right at the 10-minute line.
I
You had
my-
that well
yeah,
planned.
I had my husband time me.
Thank you. I'm going to ask if there's any questions of the presenter. And also want to thank you too, and St. George's Church for everything that you do as well. Councillor Bateman.
Thank you, Chair. I'm sorry about my voice. I'm not feeling the best this week, but excuse me. Thank you so much, through you, Chair, for your delegation, and thank you for the dozens, if not hundreds, of phone calls over the last few years. I can think of no group of people who care more about the residents of Niagara and St. Catharines than the people here today. My question to you is what makes this your priority? Like, why this as your priority?
Through you, Chair, thank you so much, Councillor Bateman. Because of the circumstances that we all find ourselves in, we know that affordable housing has not been built since 1992. And so it's going to take more than a few years to increase the housing stock, right? So while we wait, we do not want to see our unhoused citizens suffer. So that's why I say that building housing, affordable and especially supportive housing, are equally as important as providing the services that our unhoused population needs. And then based on the research that we have, signifies that there's adjustments that need to be made.
Thank you. And through you, Chair, advocacy is a big part of your group and what you do. And what else do you do for the residents that you're here speaking about today?
You probably noticed that we are neighborhood association and churches associations. We all overlap in what we do because of our faith, what we feel that our values are and what we are called to do. And advocacy is something that is part of our faith values. We must look after the vulnerable who cannot be here today because they're just too busy surviving. Where do they get their next meal? Where do I find a bathroom, which I know is problematic, but is a reality for them? Not having a closet to replace those wet boots at the end of the day because they don't have a house for the closet. So advocacy is something that I know you do, and we want to support our regional council very much, especially in our upper tier government, because funding has been lacking for a long time, as preaching to the choir, sorry.
Through you, Chair, that's why I love speaking, so thank you so much. You couldn't have said it better.
Thank you.
Thank you, Councillor. And I see no other hands up for questions. So I thank you so much for your presentation. Thank you very much.
Thank you, Chair.
So I'll move on to item 6.1, PhD for 2026 Public Health 2026 Annual Service Plan Budget Submission. I'll call on Sabrina Palazzo, Director of Health Promotions and Foundational Standards, for the presentation representing Public Health Annual Service Plan and Budget Submission 2026. Thank you.
Thank you. Good afternoon. As mentioned, my name is Sabrina Peluso. I'm the Director of Health Promotion and Foundational Standards, here today to talk to you about the annual service plan and budget submission for 2026. The purpose of today's presentation is twofold. First, to seek the Board of Health approval on the ASPs, what we call this for short, for 2026, as a requirement of the Ontario Public Health Standards. And secondly, to show you how the plan supports residents in real life. What do these words on a page look like in action? First, what is the ASP? It's a mandatory ministry-required document outlining detailed program plans and budgeted expenditures for Ontario public health units. It aligns local public health initiatives with provincial standards, covering mandatory cost-shared programs, 100% provincial-funded initiatives, and one-time funding requests. So the plan contains these components here. Just for your information, the community assessment component contains information around priority populations, unique challenges and risks for Niagara residents, and the program plans section contains everything from chronic disease prevention and well-being to food safety, immunization, school health, and everything in between. The ASP proper, which is an Excel sheet from the ministry, was not included as part of your package. It is not accessibility compliant. However, if you're so interested in reading the entire document, you may do so by contacting the medical officer of health. The ministry provides cost-shared funding to Niagara Region's Board of Health and uses the ASP as a primary accountability mechanism for the delivery and funding of mandatory and related programs and services. The budget figures included here in the ASP constitute the Board of Health's formal request to the ministry for provincial funding reflected in the Regional Municipality of Niagara's 2026 levy operating budget, which was approved on February 12th. This ask has no levy implications beyond what has already been approved for 2026. So in the first row, you'll see the ministry's planned allocation for mandatory programs is just over 25 million, which is a 1% growth over last year. The second row within base funding is the Ontario Seniors Dental Care Program. It is the only program that is 100% provincially funded. And finally, the third row, we are also submitting one-time funding requests for public health inspector practicums and vaccine fridges. The provincial cost share ratio for mandatory programs is capped at 75% of the board's gross operating budget. And with Niagara's 2026 budget submission, we're currently sitting at 65%. The Board of Health has approved a 2026 levy contribution of 13.9 million for mandatory programs. To show you what the plan looks like in real life, I would like for you to meet the Taylors. We've got names and ages here on the screen. Jess and her two kids, Isla and Sam, and her parents, Frank and Sharon. When Jess was 18, Public Health's sexual health clinic confirmed her pregnancy, and they referred her to the Nurse Family Partnership Program. She was under 25, hadn't finished high school, no job, feeling pretty overwhelmed in her situation. A public health nurse began visiting Jess at home when she was 15 weeks pregnant to teach her about healthy pregnancy, labor, birth, and newborn care. The nurse also connected Jess with a family doctor because she didn't have one at the time, and they made a plan for her to finish high school. The nurse continued to visit Jess at home until Isla was 2, teaching her about attachment and bonding, monitoring Jess's mental health, helping her with infant feeding, generally making sure that both mom and baby were well. This is Sam. He had his teeth screened last week at his elementary school in Welland by a hygienist and assistant team from Public Health. Unfortunately, Sam is among the 36% of kids with one or more decayed, missing, or filled teeth, and he's also among the 2% with urgent dental cases as identified by the hygienist. The team sent home a parent notification form and followed up with Jess, his mom, to explain the issue and the treatment. In that conversation, the hygienist also learned that Jess didn't have dental insurance coverage, so the hygienist helped her apply for the Healthy Smiles Ontario program, which covered his fillings and his root canal, and they linked the family to a dental office in Welland. This is Isla. She's in grade 7, and today is immunization day at her school. Several weeks ago, a package was sent home to parents with information about the vaccines, a link to complete an online consent form, and a number to call public health for more information. Jess called, she had a number of questions, she was feeling a little bit hesitant about vaccination. So she called and she learned about the benefits of vaccination. She also learned that she could consent to Isla receiving all 3, some, or none of these vaccines. She also learned that primary care providers, family doctors, don't routinely offer these vaccines, and that access through the school program is the best way to get vaccinated at this age. Frank and Sharon live in Wainfleet, and they are among the 30% of Niagara residents that have a private water system. Frank noticed an odd smell coming from his well on the property, so he brought the water sample into public health for free testing, saving himself $150, which is what a private test costs. He is one of over 1,500 residents who submitted a private water sample last year, and unfortunately, his was also among the 285 adverse samples containing E. coli. A public health inspector provided safe drinking water education, a potential water treatment solution, and helped Frank restore his water quality before anyone in his family could become sick by drinking the contaminated water. Poor Sharon was just working in her garden yesterday when the neighbor's dog came over and bit her on the leg. Sharon called her family doctor because the dog is always interacting with wildlife, foxes, skunks, they live in Wainfleet, and the doctor immediately reached out to public health to assess the risk of rabies exposure. Public health quickly initiated a thorough investigation. A PHI visited the dog owner's home to assess the dog's health, review its vaccination records, and place the animal under a mandatory 10-day observation period. Despite the dog's outdoor lifestyle and potential exposure to wildlife, the assessment confirmed that the rabies post-exposure prophylaxis, or RPEP, was not required. So public health intervention prevented an unnecessary hospital visit and avoided administering RPEP when it was not needed. Finally, this is Niagara's epidemiology team, and they noticed an unusual cluster of lab reports for a disease of public health significance. They verified the results, checked trends against local baselines, and looked for shared links, places, timing, settings where spread could accelerate. Working with case investigators, they narrowed the likely source and confirmed missing information. The team then issued targeted guidance to partners and the public, clear, practical, proportionate to the risk, while protecting confidentiality. By week's end, the spike had been contained, and the team documented lessons learned so they could act even faster next time. These are just a few examples of the high-quality programs and services delivered across Niagara, supporting more than 500,000 residents and many visitors to the region. Much of this work happens behind the scenes, yet it plays a vital role in keeping our communities safe, healthy, and thriving. This is the recommendation before you today, that the Board of Health approve the 2026 ASP to the ministry for a total gross budget of just over $42 million, including one-time funding requests. And as previously mentioned, it has no implications on the levy beyond what has already been approved for this year. Thank you, and I'm happy to take questions.
Thank you, Sabrina. Thank you. That was really well done. You kind of covered a little bit of everything, and you covered quite a bit of the region, so it was great. Any questions of our presenter? Councillor Bateman, please go ahead.
Thank you. Through you, Chair, to Director Pelusi. Hello, how are you?
Hi, I'm well, how are you?
Good, thank you. So I was there when the Minister of Health, Sylvia Jones, said that they were increasing their funding from the proposed 30% to 75, 25%. And I'm still, I'm caught off guard always that we're still not even close to receiving that. We are, if I did my math, and I'm at 11%, you're at 10% difference, but can you explain what we could do to fill that gap? I think it's about 11 million. I have it written down here somewhere. Yeah, I don't know. It's well over $10 million.
Sure. Through the chair, I'm wondering, where's Donovan?
Oh, Dr. Kazmati is willing to
okay,
speak
go
to
ahead.
that.
Thank you. Through you, Chair. The province has actually moved away from a funding ratio and moved towards, they now provide a funding envelope. And if you look at the legislation is quite clear, in fact, that the Board of Health and the obligated municipalities are responsible for the cost. And the minister may provide a grant at the minister's discretion to cover part of that cost. And so we have been given an envelope with which to work in, and that is the provincial grant that's provided. And that's,
Thank you. Through you, Chair, when did that change?
that has always been in the legislation.
So publicly, they've said 75% their funding, and you're telling me that that's not accurate. It is a grant.
So I wouldn't comment on, I don't, I wouldn't characterize anything that anyone else has said. But within the legislation, what it says is that there is, the obligated municipality is responsible for the costs, and the minister may provide a grant. In the past, that grant may have been a certain amount, but with subsequent changes in budgets, it may not be at the same funding ratio. And so we're provided a grant. And
Thank you. Through you, Chair, at AMO, I have it here. It says that the funding ratio returned to 75% provincial and 25% municipal, an annual increase of 1%, which you covered today. It was a previous 70-30 split. So these are my concerns, Chair, with us trying to get a grasp on our budget. We are wildly underfunded, and we don't really talk about the impact of welcoming 14 million people every year to Niagara as well. So are there any options to go back and say, could we have another $11 million to bring it up to the 75% that you said that we will be receiving?
certainly, there's always options to ask for more.
So we do that? Like, do staff say that, like, at what point does this information come to us? Because my expectation is if they say they're giving 75%, my expectation is we're presented with a budget that's 75% covered, but what we're saying here is that it's not.
So I'll just jump in there, and I think that Dr. Kazmati is probably dealing with what we all are dealing with, a shortfall. And I think it's up to us to go back and lobby the government of the day, tell them that they got to pay up. Because this is exactly what you've said, Councillor, is that, here we are, we're faced with so much money, and then we find out at this end that there's not enough money in the budget because there's a shortfall from the province. So I think that's, in fairness, up to us politicians and staff to go back and say, we need another deal. It's probably not only this department, it's a lot of our departments.
Thank you. Then through you, Chair, I don't know how do we do that? Because I guess that the point I'm trying to make is
They're
that,
doing it right now.
well, I mean, I know
we're gonna-
that Sylvia Jones is not watching this, so do
No,
we?
but I'm sure when we go to AMO, that's it, and we'll actually have to ask too, to make sure that we get staff to send those recommendations that where there's a shortfall, and it's council's direction, and we can bring that up to council to ask for that direction to make sure that the staff is trying to lobby for the money that we are shorted all the time. Councilor, anything else? Thank you. Anyone else? Seeing no other questions? Thank you very much for your presentation. Thank you, Sabrina. Now I'll ask if there is a mover and seconder for item 6.1 PhD for 2026. Mover and a seconder. Councillor Encina, and seconded. Councillor, yep, thank you. Any discussions? Seeing no discussions, I'll call the vote. Please vote electronically. Come back around. Okay, that has passed. Thank you so much. Now I'll go on to 6.2, COM 2026. I'll call on Brendan Nicholson, Manager of Homelessness Service, and Mike Arfreight, Financial and Special Projects Consultant, for the presentation respecting supportive housing strategy implementation plan. Welcome.
All right, good afternoon. My name is Brendan Nicholson, and this is Mike Iafrady, and we are here to talk to you about reducing homelessness in Niagara through supportive housing. Staff have developed the supportive housing implementation plan at the request of Council to identify an approach to developing new supportive housing units as quickly as possible while balancing taxpayer affordability. We're seeking your endorsement of that plan today. There's a lack of housing in Niagara that is affordable and has appropriate supports, which is leading people to experience homelessness longer than they should be. Right now in Niagara, we know that shelters, emergency departments, and the justice system are being strained to provide expensive services to respond to those experiencing homelessness who need supports. If we don't increase the supportive housing, these other systems will continue to bear the high cost with little to no progress toward measurable reduction in homelessness. The Supportive Housing Implementation Plan outlines how to increase our supportive housing units. Let's review the plan. First, it's important to recognize that supportive housing is a critical component to reducing homelessness. Second, the responsibility for developing 945 new units must be shared between the region, nonprofit housing providers, health service providers, and local area municipalities, with the bulk of development coming from nonprofit housing providers. Third, the role of Niagara Region will focus on system coordination, partnership development, site identification, and ensuring alignment with demonstrated need. The region may do some development if the conditions are right. And finally, Niagara must have some skin in the game. We will present a scenario where the region can take modest yearly contributions that will have a major long-term impact on overall net new unit development and operations. In September of 2025, staff brought Niagara's supportive housing strategy to this committee, which described supportive housing and outlined the need to grow supply from 427 units currently to more than 1,300 over the next 10 years. As the municipal service manager, Niagara Region oversees the homelessness service system. The region is not mandated to develop, own, or directly operate supportive housing. However, it plays a critical leadership role in coordinating funding and directing its delivery. Most net new supportive housing will need to be developed and operated by nonprofit housing providers and health partners. Niagara Region's role will focus on system coordination, partnership development, site identification, and ensuring alignment with demonstrated need. The region may contribute to operating costs and capital costs where appropriate, strengthening accountability, enabling service standards, and improving access to provincial and federal funding that often requires municipal participation, that skin in the game I mentioned. The region may also act as a flow-through for provincial operating funding in its role as service manager. To find the appropriate nonprofit housing providers, Niagara Region is committed to posting an annual expression of interest geared toward organizations that have an interest in growing their existing operations or expanding into Niagara from elsewhere. The region will consult through the project visioning process and may provide project management services and letters of support to enhance funding applications. When supporting nonprofit providers through the EOI process, or if a capital funding opportunity arises for the region, the plan outlines an approach to identifying viable sites. This process incorporates due diligence related to zoning, servicing, planning requirements, community context, and access to amenities. This approach allows the region to adapt to changing land availability, partnership readiness, and funding opportunities. Mike?
Thank you, Brendan, and good afternoon, committee members. So I'm going to walk you through the financial modeling process and explain the financial implications. So the plan is intended to allow the region to be dynamic and adaptable in response to supporting housing opportunities. And the focus of the exercise was to determine the long-term financial costs, both capital and operating, while creating a funding strategy that ensures fiscal responsibility. Now, when building the financial outlook, we worked off some key assumptions outlined on the slide here, with further details available in Appendix 1. So before developing an appropriate funding strategy, we first needed to understand the magnitude of the development timeline as a whole over the next 10 years. So the total capital requirements are estimated based on an average cost of $375,000 per unit, and future construction costs are determined by analyzing the project schedule and accounting for cost escalations to reflect increasing material and labor expenses over time. So based on the forecasted development timeline and said cost escalations, the current best estimate for total capital costs is approximately $253.4 million. So the operational impacts of the implementation plan are based on 3 different models. We have highly supportive, and scattered site operations, each with varying levels of wraparound services, which of course require different levels of funding. Now, it's important to note that the goal of Niagara Region is not to provide these services internally, but rather understand the associated costs in the event Niagara Region flows any funding to service providers. These estimated costs were determined based on doing jurisdictional scans of current operations in Ontario and building out pro formas based on expected unit count by category. The total operating costs over the 10-year project scope is estimated at $276.7 million. So funding for the implementation plan will require a multifaceted approach that combines various funding sources in order to maximize our impact. And the first source will come from rent revenue. And this is basically provided by provincial social assistance to tenants, which helps offset some of the operating costs. And it's important to note that some community partner sites also have commercial spaces for rent, which adds additional revenue. The second potential funding sources will come from operating placeholders. So our budget planning bylaw requires Niagara Region to budget for operational costs at the time of capital budget approval. And therefore, if Niagara Region decides to build and own any future units, unused operating funds during construction will be funneled back into the Housing Services Reserve to help fund future needs. The third source that we have are incremental levy contributions. And this is an annual contribution from the levy to help us achieve the recommended funding goal over the 10-year period. And we'll discuss this further on the next slide. And lastly, we have provincial and federal grants. And this is required to make up the bulk of the funding. And the goal is to utilize the implementation plan to get senior government support for new unit growth through advocacy efforts and applications for existing funding programs. So the incremental contribution forecast shown in the red box is what staff are recommending as a funding scenario, and it will be subject to the annual budget review process. So I want to emphasize you're not committing to the 10-year funding recommendations today. The contributions were determined based on the supportive housing motion that was passed by Council in December, outlining an annual increase between 0.15% to 0.19% of the general levy. The 2026 supportive housing contribution in the amount of $840,000 has already been approved and included in this year's budget. The remaining 9-year forecast represents the associated dollar value at the top end of that range, so approximately 0.19%. By making these small incremental contributions over a 10-year project timeline, we're able to minimize the impact on each annual budget cycle while allowing the base budget to compound. And at the end of the period, Niagara Region will be in a strong position to provide ongoing financial support if it is necessary. To put things into perspective, the total cumulative contributions over the 10-year period represents approximately 25% of net operating requirements or 26% of total expected capital costs. Now, whether these funds are used for capital or operating purposes will be determined on a case-by-case basis depending on what the bottleneck is for our community partners. Generally speaking, staff feel positioning the funds to be used for operational support should help get more units built faster, as operational funding is typically more challenging to secure than capital funding. Also, from a risk management perspective, construction is unlikely to proceed without secured operating funds, as it creates service delivery risk. A project is also more likely to be considered shovel-ready for capital funding programs once those operating dollars are secured. Now, before I pass it back to Brendan to wrap up, I want to remind everyone that staff have developed this implementation plan at the request of council to identify an approach to get units built while balancing taxpayer affordability. And this plan should help achieve that goal. While we are not mandated to provide supportive housing, getting people off the streets, the supports they need, and a place to feel safe benefits all members of our communities at a lower cost to the overall system.
Thank you, Mike. And to wrap up, as you can see here, progress is already underway, and new units are expected to come online by the end of 2026. As the plan will be dynamic and adaptable, staff are committed to providing an annual update to this committee regarding ongoing progress. Council's endorsement of this plan places Niagara in a strong position to advocate to other levels of government, demonstrating the clear asks and return on investment that will help us reach our goal. Thank you for your time, and now we are happy to answer any questions.
Do we have any questions for the presenters? Councillor Olson?
Thank you for your presentation, and I think looking back on this, the report, I recall that I liked it because it was deliverable, it was measured, it didn't have that big hump in the middle of it, and it was something that was achievable. I'm just wondering about your slide number, I guess it's 13, where it says that rent revenue for the project will be 15.8 million and 3%. Is that how much the rent revenue carries of the project?
So that would be over the entire, through the chair. That would be for the entire 10-year period. And that is 3% of total costs, so the operating plus the capital portion.
Plus the capital
Yeah.
costs. So in comparison to the operating costs, I guess, the operating costs are said to be $277 million, and the rent is $15 million.
Correct.
Shouldn't that be a little higher, the rent portion of it? Why does that look like it's a low number to me?
So through the chair, the rent is through social assistance programs. So there is a max that, we're able to collect from that. So that's the reason why, you see it being lower than you would expect.
Okay, and thank you. And does this include, does the report in your analysis include debt reduction and mortgage retirement as we go along, and we step down for that, or what happens to the debt as we retire it, as mortgages mature, and maybe within your 10-year program, maybe they don't, but where does the money go from that? Does that go back into the program?
So through the chair, we're not anticipating taking on any debt for this at this time. So the goal is to get our community partners to do much of the construction, and then we would flow through operating dollars or capital dollars, whatever is necessary, whatever they need, whatever is their bottleneck, to help them move projects forward.
Okay, thank you. And Chair, another question. If the assets are owned and operated by the organization who's successful in doing this, is there arrangement made within our agreements to make sure that in the event of financial distress, that the buildings are still available to people, the residents are still available to them?
Through the chair, that's a great question, and I think that would be something we would factor into a contract with the provider. Have some standard language around that.
Okay, thank you. Thank you, Chair. That's my only questions. Thank you very much.
Thank you, Councillor. Next, I have Councillor Goodwin.
Thank you, Madam Chair, and this is a question to Brandon. So we'll go to slide 10, where you have the supportive housing capital cost. So my question to you in that I guess, cost analogy is what type of housing, because I know there's demand for 1 bedroom, 2 bedroom, 3 bedrooms, so I'm just wondering what, I guess, formulation did you use to come up with this number as kind of per unit?
Through the chair, and thank you for the question. This type of housing is best matched primarily with individuals. So as we're looking for development here, we're looking mostly at studio units and potentially 1 bedrooms.
Okay, thank you. That was all I had, Madam Chair.
Thank you, Counselor. Counselor Bateman?
Thank you. Through you, Chair, thank you for the presentation. To be clear, I'm very supportive. I'm really happy we're at this position. But I'm wondering why we're asking for grants and not to fully fund this, because our community needs it. And as Sil mentioned, we haven't been getting any supportive housing or any of those type models since about 1992.
Through the chair, thank you for your question. We're looking to actually apply through existing funding programs, and we know in particular that the recently announced, I guess at the end of last year, the Build Canada Homes funding program specifically names supportive housing as a priority. And so we're looking at all funding sources, but making sure that we have done everything on the local level to make our projects as attractive as possible to be able to attract those funding through whatever stream is available.
Thank you, and that's not a criticism of your work. Just by the presentation, I know that you're doing an excellent job. Through you, Chair, have we reached out to the MPs to talk about this for advocacy?
Direct that to staff.
Through the chair, so this was a key item that we brought forward for both AMO and for Niagara Week, and have done ongoing advocacy, really sharing with the province the important interministerial return on investment when you look at something like supportive housing to address pressures across various systems that were outlined at the beginning of the presentation. We are moving forward again for AMO and Niagara Week this week to have very specific asks, but I think like they shared through the presentation, as we move forward, we can expand that advocacy for very specific projects, not just for things we would be doing through the region, but also for not-for-profit providers who also need support in terms of another voice to advocate for them as we're moving forward and developing more of this type of housing in Niagara.
Thank you. Through you, Chair, specifically, if we had any meetings, or I don't really know how this works, would you have meetings with our MPPs in Niagara to talk about this is what we're advocating for, help us leverage?
Through the chair, so we have had an opportunity to speak with MPP Osterhoff around this. He's aware of our highly supportive housing program that we're advocating for and the supportive housing that we're advocating for as well.
So thank you. This is just provincial. Are we speaking to MPs about this at all or no?
Through the chair, we have been connecting through the federal program contacts that we have as well. And as was mentioned, really leveraging the opportunities we have available through the Build Canada Homes program, which provides supports not only for affordable housing, but also for supportive housing programs.
Thank you.
Thank you, Councillor. I just have one question that someone asked. If you can explain what the difference is between highly supportive housing and supportive housing. One of the presenters, please.
You're welcome to take it. I'm happy to, though. Thank you. Thank you for that question. We talk about that a lot. The key feature to supportive housing is that it's matched to the needs of the individuals. And so when someone experiences homelessness, we've got a number of different measures to learn about the individuals and what might help them exit homelessness sustainably. And so for individuals who have more complex needs, longer experiences of homelessness, mental health conditions, physical health conditions, age-related conditions, oftentimes they require both the kind of the housing supports of course, the affordability piece, but the housing supports, as well as some health supports. So when we talk about highly supportive housing, that generally looks like 24/7 support with housing supports, social supports, as well as integrated health supports. Your kind of standard supportive housing would be for those who have more moderate needs, certainly still needs, but would be less likely to have those integrated health supports. They may come in, a program like Ontario Health at Home or a health clinic may come in, but they might not be integrated right into the service model. So, like I said, it's important that we understand what the individual's needs are, we match them with the appropriate program, but first we need to make sure that we have those programs to match them with.
So my other question is, how many highly supportive housing units do we have in Niagara region?
Through you, the answer is none. We don't have any currently.
Good, I just want to make that point very clear, and that goes on a number of this committee members are very aware of that. There is no place for people with severe chronic mental health and drug addiction. We are lobbying the government, and I hope that they are listening, or somebody's listening, that we get back to them, because this is one of our needs. I know that there is some talks, and I don't know if we can have an update or at all on anything from the government levels through our commissioner, because I know that she's been very, very active, Commissioner Conning, and trying to lobby for highly supportive housing, because we have all been involved in that in the last year. So could you please give us an update?
Through the chair, we don't have a specific update on that file right now, other than that we have had considerable interest from the province in terms of the information that we shared around the return on investment when you look at that as an opportunity. One of the things that we shared with the province is, if you look at 25 individuals who have really high needs, chronically homeless, really significant mental health issues, potentially addiction-related issues, status quo of providing support for that cohort of 25 individuals is $4.1 million. If we were instead to provide support through highly supportive housing for that same cohort of individuals, it would cost $2.3 million. So the $4.1 million isn't extra money we need. It's money that we're currently spending in the system as we're operating. So we've been sharing that information at the province, have had a lot of interest in how we can move this forward, and are doing further work here locally to identify how to pull together the right parties and to select a good location for more specific funding asks.
Thank you, Commissioner. As you can see, this is a challenge that we have in the Niagara region, just like everyone else across the province and across the country. These unfortunate individuals are left to go to shelters and churches and places where other people are looking to take them in. And the government of the day, federal or provincial, have to step up and help us. So it's my comment. Thank you so much for your presentation. Thank you. I will ask if there is a mover and a seconder for item 6.2, COM 8, 2026. Councillor Olson and Councillor Cisco. Any discussion? Okay, no discussion, so I will ask you to vote electronically. Okay, thank you, and that is passed. I'll move on to 6.3, COM 7, 2026. Before I ask for a mover and seconder, I will note that this report includes a confidential appendix, and if there's any questions with respect to the confidential appendix to this report, I would recommend dealing with this report after closed session. Does any member wish to discuss the confidential appendix in closed session? Okay, seeing none, I will continue on to, oops. Is there a mover and seconder for item 6.3, COM 7, 2026? Councillor Rigby and Councillor Whittabee. Okay, is there Any discussion? Okay, seeing no discussion, I'll ask for vote electronically, please. I'm sorry, Councillor Whittabine, go ahead.
Madam Chair, it's just a point of clarification. I was just, I guess, needed maybe a refresh on the timelines of this to know when it potentially, I know I see our lease expires, but is that the same timeline as the establishment of the new facility?
Okay, who can,
Yeah, is that the?
Through the chair, so we're looking at moving forward with site readiness and getting the shelter in place, and then we would have somewhere to decamp people to before we need to leave the site.
Okay, thank you. Thank you for refreshing my memory.
thank you. Now I'll call the vote. Please vote electronically. Okay, great, that has passed. I'll move on to 6.4, COM-C 15-2026, a motion. I'll call on Councillor Cisco for the motion respecting seasonal shelter and ask if there is a seconder to your motion. Councillor Yip? Okay, and I will call a question. Oh, sorry. Sorry, Councillor Cisco, go ahead.
I was just going to speak to my motion very
Yes.
briefly. I appreciate that.
It was this quiet.
It's very quiet today, I understand. I do appreciate the presentation that Ms. Roach made and the conversations that I've been able to have with her and members of the group that she represents. We have seen very clearly over the course of this winter that there is need in St. Catharines. As some on council may recall, in advance of the 2024 budget process, I did try to bring about emergency seasonal shelter. I was unsuccessful at that time. I do appreciate the work that staff did in the intervening year to put in place for this past winter the shelter space. But I think that this seasonal shelter that was put in place this past year on those cold weather days demonstrated that there is still very clearly a need for additional shelter space in Niagara during the winter months. So this report very clearly is just asking for staff to come back, explain to us what would that look like, what would the costs with it be, what would the costs associated with it be, and how would we be able to implement something like that with respect to the 2027 budget process, as well as any bridge funding that may be required to get through that period of the year, which is not covered by the 27 budget and covered by the 26 budget. So I do hope that council or the committee can see fit to support this, and we can get that information back so we can make a coherent step in the future with respect to the budget. Thank you, Chair.
Thank you, and I have Councillor Easton who would like to speak to it. Councillor Easton?
Thank you very much, Madam Chair. Just a point of clarification. Once we have this report in hand, is our assumption that because of its urgent nature, that we'll have a better opportunity or a better chance when we present this to the ministry of getting this funding? That's the first part of it. And secondly, do we anticipate that although seasonal shelters are not our first choice, that we require a bit of ease, maybe quite a bit of ease in the system, and that this will give us the ease that we would have appreciated having at different points during the 25-26 winter. Through you, Madam Chair, to the Commissioner.
Commissioner?
Through the chair, so thank you for the question. Throughout the 2025-2026 season, we really monitored metrics in terms of utilization of the shelter system, who was using it for people who opted to use the site at St. George, and we really appreciated the support from St. George for us to be able to do that. Better understanding why maybe they hadn't presented at sort of the formal shelter system. And we're going to be taking all of that information, having a meeting with our community partners in May to have a look at what's working, what's not working, speaking to individuals with lived experience to understand from them. And to your point, Councillor Easton, really looking at, we have two pieces that we need to manage within the homelessness services system. As what I always kind of think of as the short-term Band-Aid type solution to support people in crisis and to make sure that they're safe and well while we're waiting to put those, to have enough longer-term exit strategies to support people through supportive housing and highly supportive housing. So within the budget that we're allocated, we get a proportion from the federal government, a proportion from the provincial government, and some levy contribution. And within those various budget pieces, we look at how best to use that funding as we move forward. Hopefully, as things continue to progress and as we make inroads around the supportive housing piece, what we'll see is the proportion of the budget that we're allocating to more of the Band-Aid type solution will start to gradually decrease as the longer term strategies are increasing. But right now, we still need quite a bit of support to help people in the short term as they're really struggling.
Okay, and I think these are important points right off the bat. We should be very transparent with people about the fact that these don't give us long-term solutions, but they certainly do respond to what our delegation was speaking to today, to take away some of the community concern and the concern of those in the community that are putting their own efforts behind this. But this is not a permanent solution. We're still moving very, very, not slowly, but we're moving very consistently toward the safest system that we can manage to eke out of an already limited system. Is that a message that you feel is on track?
Through the chair, I think that's correct.
Okay, I think we need to stick with that message because there are no magic bullets here, but we're certainly trying a number of things at different times of the year and in different situations. But make no mistake, Madam Chair, as you have said over and over again, this still does not give us a solution for people who require very high levels of mental health supports. Thank you.
Thank you, Councillor. Councillor Bateman.
Thank you, Chair. First of all, I'm grateful for the thoughtful motion before us. Much appreciated. And I do want to read part of it because Mayor Cisco or Councillor Cisco chose not to read it, but I think this is a really important part of that I'd like to speak to. So where it is understood that shelter beds are not the best solution, but merely a Band-Aid stopgap while the Niagara region embarks on a construction of appropriate supportive and highly supportive housing. So the reason I'm grateful for that is because I hate the fact that we are talking about more and more shelters. And unfortunately, it is a necessity to keep people alive. And I feel a great deal of shame living in a community where so many people are unhoused, and it's just I think everybody agrees here, like it should not be this way. I have no doubt that this is going to pass, but when we don't do this as part of our work, the burden falls on other areas. And I just want to remind Council. I received an email. I solicited the email, but from somebody at Niagara Health. It was an excellent email full of tons of great information. But there were 5,097 people who were not housed last year who went to the emergency room for reasons that could have prevented. They listed them as cellulitis, bacterial pneumonia, diabetes, COPD, and substance related. So that is a significant burden on our health system. If we don't continue along this path. But I would really love to see at a council one time soon, maybe in the next 10 years, that we are closing our shelters because they're not a necessity. So Right now they are, and again, I'm grateful for the motion and the thought that went into this from staff and of course Councillor Cisco. So thank you, Chair.
Thank you, Counselor. Counselor Olson.
Yes, thank you, Chair. And I'd like to say something to the presenters this afternoon there. That's an important service that you're delivering to our community. It's a difficult problem, and it won't be solved by one group at a time. It's going to take partnership, and I really do appreciate the work you're doing. And you can see the result of your work in some of the motions that we have here, because the quality of this motion is exceptional. And the analysis that will come out of it will be exceptional as well, because I've come to look at the analysis, financial analysis, and the supporting analysis as being investment grade type things. And that's what we need, and that's what we need for ourselves to make decisions, but to be credible to funding sources. So I appreciate this motion very much, and it looks elaborate, but it's right on the mark, and I'm going to be voting in favor of it. Thank you.
Thank you, Counselor. I see no other speakers, so I will call the question. Please vote electronically. And that has passed. Thank you so much. Now we'll move on to point 7.1, PHDC 7, 2026. I will call on Karen Let's Grow, Chief Niagara Emergency Medical Services, for the presentation respecting efficiencies in EMS. Karen, whenever you're ready.
Thank you, and through you, Chair, and to Council, good afternoon. My presentation today is intended to demonstrate to Council the efficiencies that EMS realized in 2025 to offset some of our system pressures. We know the cost of delivering pre-hospital care is rising, and it will continue to rise. These pressures include call volumes, but also most recently the fuel that we're seeing, those rising costs. And we have to find ways to become more efficient and demonstrate good financial stewardship while maintaining the high-performing system that we are. All right. Okay. Efficiencies in 2025 were gleaned in 3 ways: through process improvements, strategic partnerships, and targeted investments that will support long-term cost avoidance to build a system that's both effective and sustainable. I'm going to walk you through some of those efficiencies that we realized. Before we get to them, it's important to understand where these efficiencies could come from. And as you see on the chart, 85% of our annual operating budget is labor costs. The other 15 represent essential obligations such as fuel, medical supplies, fleet maintenance, those types of things. And as such, our operating cost is largely non-discretionary. So the majority of our labor costs come from unionized staff, and they're either freely negotiated or arbitrated. That leaves that 15% of our operating budget available to find these efficiencies to offset those system pressures. Ontario's presumptive PTSD legislation for first responders, introduced in 2016, improved access to WSIB benefits by presuming PTSD is work-related, but it increased pressure on service provider budgets. WSIB costs rose annually up until 2025, when we saw a decrease of 6.04%, resulting in a savings of $329,910. Niagara EMS, and I'm proud to say, has led EMS providers provincially in proactive mental health programming, initiatives like decompression time, mental stress leave days, and improved supervisor oversight, such as tracking call types and conducting check-ins with our staff, have helped reduce WSIB claims and better support staff who have experienced a series of traumatic calls. In 2025, sick time costs also decreased by 2%, despite increased staffing. a new process, routes sick calls through scheduling with follow-up support from operations superintendents. They're calling their staff after they report sick, and that improves employee oversight and care, and it just is a better way of understanding what our employees need so we can support them. Strategic partnerships have also contributed to increased efficiencies. Every year, EMS provides training to all our frontline staff, and this year EMS partnered with Hamilton EMS to take advantage of some expensive but worthwhile training in workplace violence prevention. Rather than paying $18,000 for the cost, Hamilton also wanted to take part in this training, and so we just split the cost at $9,000 each. In 2025, we vacated our North Welland Station on Abbey Road when we learned that our lease was coming up for renewal and the space required roughly $200,000 in leasehold improvements. The station was not optimally located as per our master plan, and we opted to vacate our crews temporarily to the King Street station. Concurrently, an opportunity arose as we learned that the Welland Fire Department was in the process of moving out of their fire station at Prince Charles, and as that station's very close to where we need to be for optimal response time reliability, we leased that space and we'll be moving into that refurbished space. But in the interim, in 2025, we saved $12,000 in leasing costs. EMS was also able to purchase a command trailer, which is fully funded through a grant from the Ministry of Natural Resources. This trailer will be shared by 2 other EMS service providers, Chatham, Kent, and Lambton County, should they require it. Its function is to provide a mobile medical command post for large-scale events or emergencies. Staff will be able to see and treat patients on scene in sheltered and well-lit conditions. EMS has found efficiencies through optimization of our existing contracts. We use a lot of cellular technology, and each paramedic carries a telephone or a cell phone, and we use text messaging to notify them of calls, and we send them call information, which is great because it's fast. It can also quickly become very expensive. Rather than paying a set amount of data for each cell phone in our system, we've pooled the data among all our cell phones, which has resulted in a 75% monthly decrease and a savings of $22,610. The annual projected savings of almost $67,000. In 2025, EMS took advantage of a pharmaceutical rebate program through our contracted pharmaceutical provider. Any medication that is expired before it is used can be sent back to the pharmaceutical provider for a rebate. We saved $11,782 in 2025 with projected annual savings of $16,000. Finally, in 2025, EMS partnered with Niagara Region Seniors Services in the purchase of Operative IQ. This is a digital modernization fleet, inventory, and asset management system. For EMS, the system replaces years of fragmented manual and paper-based processes and merges them into a single integrated solution. It will reduce costs by reducing waste, improving operational readiness, and avoiding costly repairs. For our vehicles, we've increased visibility into the health of our fleet, intervening early if issues are seen that decrease the wear and tear of our vehicles, which in turn will reduce the need for those costly repairs when vehicles break down, prolonging the life of those vehicles. For our assets and inventory, we will have full asset life cycle tracking and accurate real-time inventory data, which will reduce over-ordering. We anticipate a reduction of medication waste costs through expiration and reorder automation. All of those features will ensure that not only will we reduce costs, we'll have greater confidence in our emergency response readiness that Niagara residents rely upon. And so through process improvements, strategic partnerships, contract optimization, EMS realized $611,326.14 to offset our system pressures. And those cost savings additionally put us in a position to continue saving in the years to come. Thank you.
Thank you,
Any
Chief. I'm going to
questions if
ask if
anyone
there's
has any.
any questions of the presenter. Anyone have any questions? Councillor Bateman.
Thank you. Through you, Chair, could we go back to the labor, that pie chart? Thank you, Chief, and congratulations on all those savings. So the labor costs, how much of that is overtime? Do we know how much we?
I would have to go back and get you that actual number. I'm not exactly sure.
Okay, and do we provide more overtime for part-time or full-time staff?
I don't know. I'm assuming it's full-time staff because that's who's working mostly.
Okay.
I'll have to go back and check though.
And do we know, sorry, I'm not feeling 100%. Do we know when the overtime, are there peak periods of overtime?
Through you, Chair, I'd have to go back and check. I think every day's different, every season's different. It just depends what's going on.
Would that be something that we could get the information at the next council, at the next public health meeting?
Sure. Provide that.
Okay. No other questions. Thank you.
Thank you very much. Council Olson.
Chair, a question about attendance management and the WSIB and return to work policies and that type of thing. I'm assuming, do we manage that in-house through our department, or do we have an external source for that management of that?
Through you, Chair, for WSIB management, we have a psychological health and safety facilitator that we've hired that helps with some of that management, but WSIB does also give us access to their staff. And so the intent is to really work together to find the best solutions for our staff that are either out of the workplace for a certain period of time or returning to work.
And do we have positions for them to assume when they come back if they can't take their old position? Do we have something that can be done in the interim to?
Right. The idea is when someone experiences, say for instance, a traumatic, through your chair, a mental health stress injury, for instance, we do offer immediate modified work. And so we have a list of those duties that we can provide to staff so that they remain in the workplace. And when they come back, we meet with them to find out what their abilities are. And based on what they tell us is, something that we can do to provide them meaningful work, even if it's not even doing work physically at a station, we can provide them meaningful work from home if they choose to accept it.
Thank you, and through you, Chair. So we don't try and predict an outcome. We just have a process that
we do
is fair to the employee, that doesn't try to force them into anything that they're not able to do at that moment. The other question I had is bottlenecks in the system, and I'm not informed of this as I should be, but when somebody arrives at the hospital with an ambulance, is it true that they until the patient is taken over by the hospital or taken custody by the hospital, that the crew has to stay there? Is that correct? Or generally correct?
It's through you, Chair. That's generally correct. We want to make sure we're handing over care, and so we stay with our patients until they get triaged, and then the nurse at the hospital, the triage nurse, typically directs us where to go with that patient.
Yeah. So, but we have a vehicle sitting there unused during that period of time. Is there anything that can be done to change that, or?
I think through you, Chair, I think we're talking about like offload delays if they're there for extended periods of time. Through you, Chair, we worked really extensively with Niagara Health, and our offload times have decreased a lot, I would say, over the course of the year. And we continue to meet with them and look at ways that we can work together.
Okay. Thank you. Through you, Chair. I said it was clear that I didn't understand and accept in general, so thank you for that. Thank you.
Thank you, Councillor. And I see Dr. Kazmati wants to address.
Through you, Chair, and to the councillor, we have invited, we've suggested to Niagara Health as well that they come present on some of the changes they've made in order to reduce those offload delay times. We don't want to tell their story for them, but I think they have done some wonderful work, and we're certainly seeing the impact of that.
Thank you, Dr. Kazmati. Councillor Olson, are you good now?
Yes, I am. Thank you.
Okay. Thank you. Next, I have Councillor Whittabine.
Thank you, Madam Chair. I think I just probably make a comment here and build on what Councillor Olson talked about, the sick time cost, and it's, to me, it's not necessarily about the money saved. It's about the reduction of hours, which, in my eyes, that's a 3 point something full-time position. So I'm really happy to see that you focused on that, because I think that that, we'll call it morale, and that process in the workplace is very important in this profession, to have that. So I really appreciate that, because we rely on our staff to be basically on all the time. So so this is great that you've spent that time and energy on that focus. So I just wanted to thank you.
Thank you.
Thank you very much. Thank you, Chief. We greatly appreciate it. Thank you.
Thank you.
Okay, now I'll ask for a mover and seconder. I'll ask Counselor Incinner. Thank you so much. And let's see, Counselor Foster. Would you second it?
I will.
Thank you so much. Any discussion? Okay, seeing no discussions, I will ask the question. Please vote electronically.
Chair, could you reset the vote, please?
Okay, and that has passed. Thank you very much. Now moving on to 7.2, I will call on Amanda Kirkwood, Manager of Analytics and Informatics, for the presentation respecting the Health System Planning Report. Go ahead, Amanda, when you're ready.
Thank you, Chair. Good afternoon, everyone. Just make sure this works. Okay, so I've gone too forward. Okay, so today I'm providing an overview of the report, Planning for the Future, a Data-Informed Health System in Niagara. It's a comprehensive look at Niagara's health system capacity intended to support coordinated, evidence-informed planning through the Niagara, Ontario Health Team. My name is Amanda Kirkwood. I'm the manager of the Public Health Analytics and Informatics team. And a key part of my team's work is population health assessment and surveillance. I am joined with some of our key collaborators in the audience, so I do appreciate that they are here in case there are questions at the end of this presentation. Okay, so health system, apparently it's going too fast, apologies. Health system capacity should reflect what's happening in our community, so people's health needs, demographic change, and evolving public health challenges. A resilient system needs the right mix of infrastructure, workforce, data systems, and coordination to deliver timely, high quality, and equitable care. So this report is a descriptive current state assessment, and it's meant to align partners on current conditions and emerging pressures, as well as to support more complex planning and analysis in the future. It also establishes a baseline for identifying priorities for improvement and investment over the next 5 to 10 years. So this was a Niagara-wide collaborative effort among the regional partners that you can see here on this slide. And this was our first collective effort of this kind for Niagara. So Niagara Region Public Health led the quantitative analysis using existing findings from existing data sources. Niagara College, Brock University, and Niagara Health contributed data and expertise. And Niagara Health Knowledge Institute supported a literature review to help define health system capacity. And the Niagara, Ontario Health Team supported all of this work. So we used the Canadian Institute for Health Information, known as CIHI's, definition of health system capacity, which is defined as the adequate number of supplies and equipment, so stuff, space and structure in which to treat patients, which is space, trained personnel as staff, and policies and procedures or other systems to meet the healthcare needs of the population. So to describe capacity throughout our report, we use this 4S framework. And this is a practical way to talk about capacity because pressures usually don't show up in one of these areas, and solutions rarely work if they're isolated fixes. So in terms of the scope of the assessment, here you will see the various services that were included in the scope of the assessment. And so the scope really reflects how folks move through the different services within Niagara. And we also included housing-related supports, recognizing that housing instability directly affects health outcomes and increases demand across the system. So what gaps did we find that exist within the healthcare system? In the assessment, we identified 9 themes or notable gaps that persist with the local health system that impact access, equity, and overall population health outcomes. So they are, as you can see here on the screen, increasing chronic disease burden, improving primary care access, understanding mental health and substance use, communicable disease and outbreak preparedness, addressing health equity and access to care, EMS pressures, hospital system pressures, increasing demand for long-term and hospice care, and understanding homelessness and supportive housing. So across these 9 themes that I just presented, the report includes 48 recommendations. So they're short, medium, and long-term recommendations, also using the CHI 4S lens. So to provide an example, one example where public health could have a leadership role, or would likely have a leadership role, is strengthening outbreak response protocols and improving communication pathways across public health, hospitals, long-term care, primary care, and community organizations. And this is to support the theme of communicable disease preparedness and the OHT strategic pillar of system integration. Another example where public health could take a leadership role is through the strengthening of social demographic data collection and helping partners standardize their approach in the collection of this information. However, overall, local health system partners are well positioned to bridge gaps by strengthening collaboration, improving integration, tailoring solutions to Niagara's needs, and supporting people who face barriers to care. So we wanted to highlight that workforce is one of the most important drivers of health system capacity. So many of the pressures that we actually identified throughout the assessment are really closely tied to health human resources. So this means that workforce planning needs to support service delivery across the full continuum of care. And so as Niagara's population changes and needs become more complex, coordinated health human resources planning becomes even more important. So what did we find when we looked at workforce planning? Labor market and predictive data show an ongoing demand for nurses, support workers, health managers, dental professionals, and pharmacy roles. We also expect growth in physiotherapy, occupational therapy, and massage therapy, which all aligns with Niagara's aging population and increased need for mobility, recovery, and post-acute support. A continued strong demand for nurse practitioners and nursing supervisors reflects the shift towards interdisciplinary care and the need to fill gaps in primary care and community care as well. So what does this mean for health system capacity? The main takeaway is that the pressures across the system are interconnected. Demand growth, capacity constraints, workforce pressures, and social factors like housing instability don't happen independently. They reinforce one another, hence the domino effect here in this visual. As a result, pressure in one part of the system often shows up elsewhere rather than being resolved in isolation. So by bringing this evidence together, it provides a shared evidence-based view of our current and emerging pressures, and that shared understanding is what supports better system-level planning, helping partners align on priorities, understanding trade-offs, and planning for the right sequencing of work. And so to end, our next steps are really focused on making sure that the right partners have this information for their planning. Improving health outcomes in Niagara takes more than identifying these pressures. It really requires that coordinated, evidence-informed action across sectors. And so the findings and recommendations are intended to support priority setting, aligning planning efforts, and strengthening integration across the continuum of care. And so addressing these gaps will require collaboration that will be facilitated by the OHT across hospitals, primary care, public health, community organizations, social services, municipalities, Indigenous, Francophone, and Black community partners, while keeping equity, access, and sustainability central to the work. So just a final note, again, to make sure we are making sure all the right people have this information for planning, and this is what is going to help us to be equipped for the future with a data-informed health system in Niagara. Thank you. I'm happy to take any questions.
Yes, is there any questions for Amanda? Councilor Encina, please go ahead.
Thank you, Chair, and thank you for the presentation. Through everything you've gone through, did you find any inequalities between different parts of this region with regards to healthcare?
Through you, Chair, we have done a bit of analysis drawing on Public Health Ontario's Ontario Marginalization Index. And so in the report, we do look at different areas within the municipalities in terms of their kind of marginalization. And where possible, we try to pull data by municipality across the various health indicators, but I don't have those numbers my fingertip right now, but I would be happy to provide that after.
And through you, Chair, I guess I'm not gonna beat around the bush. What you've done so far is great. Do you have the ear of Niagara Health? From what we've seen, I think this is fantastic. I really do. But the problem I see is that, do we have a captive audience? Do you believe we have a captive audience is, I guess, my question. Or maybe through the doctor.
Dr. Cosmani?
Through you, Chair. So yes, I think we saw the partners who were involved in creating this report.
Yes.
I think the purpose of this report is really to see what are the needs in Niagara, what is going on, what is happening. I understand the question you're asking. I don't have an answer for you. I'll have to go back and reference through the report, and perhaps we can connect offline. And I'm happy to then provide some of those answers, what's available. I think the audience overall, though, this is one of those planning documents that we can use. There's multiple. So we're involved in that, the hospital system, the education sector, the OHT, as well as the provincial government then. And we can look and see what do we have, what do we need, where are the gaps, where are the pressures coming, and how do we work together all to support that.
Okay. Thank you. And and through you, Chair, and again, thank you for the presentation. And I think we're going to see that there are gaps in the region. And I'm just hoping we can bring those to the forefront and that hopefully someone will be listening at the end. Thank you, Chair.
Thank you, Councillor. Councillor Olson?
Yes, thank you, Chair. And a question for you about health equity. You mentioned that health equity was one of the parts of the study, and I'm wondering about the role of caregivers in the health equity. Did you examine it into the detail of that, where that fits into health equity? And the reason for my question is caregivers are mostly women in our society, and that falls to them to be part of a caregiving society that interrupts earnings along with other things and leads to all sorts of inequities. I'm just wondering if that was considered in your study.
Thank you for the question through you, Chair. Caregiving was not one of the services that we had looked at, but certainly could be an area that we could explore in future iterations of this type of kind of planning data exercise.
Okay. Okay, thank you for that. And you had 48
Councillor,
recommendations.
I'll just interject. I see there's a staff person that would like to address your question as well.
Yes, thank you. Through the chair.
Oh, that'd be great.
We did not look at that specifically in the context of this report. However, from what I understand, the OHT just completed a comprehensive report around caregiving. And I think that was through the palliative care working group. So we can find that report and then circulate afterwards.
Okay. Thank you. Glad to have that answer. Thank you. So you had 48 recommendations. Now, where do the recommendations fall in your four unit study there, your four facets of study? Do they equally, or can we have a look at them at some point too?
Through you, Chair. So yes, the 48 recommendations are across the 9 themes that we identified throughout the assessment. They are included in the report that was linked, I believe, within the memo. They're not included in this presentation, but they are linked within the memo that's included in the package.
And through you, Chair, are they costed as well? Do you have can you just at least say high cost, medium cost, or low cost, or any of that kind of thing in your recommendation?
Through you, Chair. The idea is that through the work that we did for the Niagara Ontario Health Team, we came up with an engagement plan for the Niagara Ontario Health Team to come together. So all of the system partners to discuss the recommendations, what they mean, what the right sequencing is in terms of like the order of recommendations and implementation. And then certainly those types of conversations around budget would be included in that type of engagement session.
Thank you. And finally, Chair, so do you have, what allowances were made in your study for future development and developments that are underway right now in the healthcare system? Namely the hospital in Niagara Falls. Is that considered?
Through you, Chair, maybe I can start and maybe pass to Dr. Kazmani, but at this point, we used existing data that we had from the hospital system, so we didn't do any predictions around what this might look like with the new hospital.
Okay, thank you.
Okay.
Thank you, Councillor. Next, Councillor Bateman.
Thank you, Chair. Could I don't know what it means, take it offline, but I'd like to hear whatever you're sharing with Councillor Encina, to answer his question. Thank you, Chair.
Okay, thank you. I see no one else wants to ask any questions. Thank you, Amanda. Thank you so much for the presentation. Greatly appreciate it.
Thank you very much, Chair.
Now I will ask for a mover. Councillor Whalen, will you move the report? Thank you so much. And I will ask Councillor Crater, will you second the report? Looks like that's a no.
Definitely. Thank you.
Thank you. I will call, is there any discussion? Seeing no hands up, I will call the vote. Vote electronically, please. Okay, that has passed. Thank you so much. Does any member wish to vote on any of the remaining consent items, agenda items 7.3 to 7.5 separately? Oh, Councillor Cisco.
Yes, Chair, 7.4, please.
7.4. Okay, anyone else? See any? Okay, so we'll deal with 7.4, COM 9, 2026, Welcoming Street Initiative Funding Information Request. Councillor?
Thank you, Chair. And I'm hoping to, I'd like to amend the...
I just have to make sure I have a mover and a seconder.
I will move. I think Councillor Yip will second.
Thank you. Thank you so much. Okay.
And I'd like to
Thank you. Sorry
amend-
about that. Go ahead.
I'd like to amend the recommendation that the report be received for information and that staff utilize one-time gapping dollars to be reallocated to support Welcoming Streets Initiative until 2027 budget consideration is complete. That was the first option that was indicated in the report. And if I can just speak briefly to it, Chair. We had a very fulsome conversation about Welcoming Streets, I believe at our last meeting. I appreciate staff getting this information in front of us as quickly as they did. Timeliness is sort of the essence in this particular situation, as the funding for Welcoming Streets does run out at the end of April. So I'm hopeful the committee will support this and that council will ultimately support it at the end of the month to ensure that the program is able to continue. As staff have indicated, there are no, there are some dollars that are currently approved in the levy that aren't going to be necessary, up to, as it says in the report, $120,000 of those one-time gapping dollars could be reallocated to support WSI until December 31st of this year. That would give us, or I suppose, give the next regional council the opportunity to have the budget deliberation and identify at that time, after the final results of the work being done by Brock University on the outcomes is able to be examined, and then council can make a more fulsome decision about continuing or not. As we heard at the last meeting, though, the preliminary information and the anecdotal data that I've gotten as the mayor in St. Catharines has been positive. Business owners have seen that the very visible effects of homelessness in our community have decreased to a certain extent, and that people are being better directed towards services. So I do hope that committee can see fit to reallocate these dollars or make the recommendation to council to reallocate these dollars so that we can continue this program running for the remainder of this calendar year. Thank you, Chair.
Thank you, Councillor. Next, I have Councillor Bateman.
Thank you, Chair. Have we approached the province at all to ask to fund this?
Staff?
Through the chair, we have put in an application for a grant proposal to cover that interim period, but we won't know about that for a few months in terms of whether or not that grant proposal was sufficient. So option one that we included in this report in response to the request was just to ensure that if we didn't want to break in service of the program, that we had a funding option to address that gap.
Okay, thank you. And when were these were these grants available? Is it do they release them at a certain point, and that is the difference in the gap, or did we apply late, or?
Through the chair, we applied in a timely fashion, but it takes a little while before you get the response. And then generally there's opportunity with the type of grant that we applied for it to be retroactive to the time that the funding would have been needed. But we needed a stopgap measure to be able to flow those funds in the interim to the agencies providing that service.
Thank you very much. Thank you, Chair.
Thank you. Next, I have Councillor Foster.
Yeah, thank you. Thank you, Chair. I'm just wondering to Mayor Cisco, budget, when it comes into play, when we have these changeover years, very oftentimes doesn't get completed until February type of thing. I'm just wondering, do you think it would be worthwhile suggesting that this goes until the end of February next year, the funding at this point, so that there is some buffer time before that might end and other decisions are made?
Through you, Chair, I would be happy if someone wanted to add an amendment that appropriate dollars be encumbered until such time as final 2027 budget approval. Or I'm happy to make that amendment as well. I appreciate the comment, and I think it's a valid one. We do sometimes push a little bit deeper into the new term before a budget is actually passed.
Yeah. I personally think it's a friendly amendment. So if you and your seconder, I don't think that's being too terribly out of line, pushing it to the end of February.
Very friendly.
I see head shaking, so it looks good. Councillor Foster, anything else? We're good?
No, I'm good. Thank you.
Okay, thank you so much. Seeing no other speakers there, I will call the question. Please vote electronically. Oops. Record a vote. I'm sorry. Please, record a vote. So I guess we're just going to get the motion up so that everyone can see that too. Okay, the motion has been amended and it's now up, so we'll have the clerk proceed with the recorded vote.
Just a point of order. December 31st, no, I think, didn't we just friendly amendment change that to February 20, whatever it is?
Yes, thank you.
I can't remember if it's a skip year or not, so.
You can say March 1st.
It's a February 28th.
Chair? Sorry, it's not really a point of order, but I think it can just say to support the program until the 2027 budget is approved, since we don't have an actual date for, okay.
It's good. Okay, mover and seconder, you're fine with that, as it reads, right? So it's going to last until the budget's approved in 2027. Okay, record a vote.
Counselor Bateman,
Yes.
Counselor Crader, Counselor Diodati, he's not on, is he? Counselor Easton, Counselor Foster,
Support?
Acting Regional Chair Ganan, Counselor Encina,
Support?
Counselor Yip,
In favor?
Counselor Jordan,
I'm in
Counselor
favor.
Oh, thank you. Counselor Kaiser,
In favor.
Counselor Olson,
In favor.
Counselor Rigby,
In favor.
Counselor Seaborn,
In favor.
Counselor Cisco,
Support?
Counselor Sorrento,
Yes.
Counselor Whaling,
Support.
Counselor Woodavine,
Support.
Co-Chair Kiokio,
In favor.
and Co-Chair Morocco.
In favor.
And that's carried.
Okay, that is, sorry. So now I have the remaining other two points, 7.3 and 7.5. Can I have those vote on in a block, please? I will ask for a mover and seconder. If I can have Counselor Rigby, and let me see someone, Counselor Kaiser.
Yes, happy to. Thanks.
Thank you so much. All right, any discussion? All right, saying no discussion, let's vote electronically. Thank you. Okay, great, and that has passed. So now moving on to 8, is there any other business, items for business, other business? Whatever, I gotta get that out there. Blah, blah, blah. Counselor Bateman.
Thank you, Chair. I'm wondering if I could get a staff report. A couple months ago, I was contacted by a woman in St. Catharines who was at risk of losing her her subsidized childcare. I've talked to Commissioner Koenig about this, so I know that at 3 months of job loss, correct me if I'm wrong, you lose your subsidy. Is that correct?
Through the chair, we follow the provincial guidelines in
Right.
terms of that.
Okay, and we so as far as I understand it through you, Chair, is that we can make our own rules around that. The reason I'm concerned, obviously, she's a single parent, lots of distress trying to find a job, and then losing a major support to her income as well. So I would like a staff report on that so we can discuss it at committee.
Yes, definitely. Yes, great, thank you. Counselor, anything else?
Sorry, real quick, could we have that in May? Is that?
Could that be at the next meeting you're asking?
Yeah.
Yep, that be next.
Actually, our submission deadline's already passed, so it'll have to be for the following cycle.
Well, I don't know what that means.
We've already submitted all of our reports for the May cycle, so it would have to be for the June cycle.
Oh, you mean like, oh, okay, sure.
Counselor, you're fine? Great. Okay, no other business. Let me see, I took a quick look at the screen. Seems like everyone's good. So our next meeting will be held on Tuesday, May 12th, 2026 at 1 p.m. in the council chamber. This meeting is now adjourned.
Take care, everyone.